Welcome to LA Currents. I'm Rasha Goel. November is Alzheimer's Awareness Month. 5.8 million Americans age 65 or older are living with Alzheimer's dementia. To talk to us more about this disease is Dr. Helena Chui, Chair and Professor of Neurology at USC's Keck School of Medicine. She is internationally recognized for her research on Alzheimer's disease and vascular cognitive impairment. Thank you for joining us, Dr. Chui.
Thank you very much, Rasha, for the opportunity.
Absolutely. You know, this is a very important disease, and especially with this month and the number of growing cases. First of all, talk to us a little bit about Alzheimer's and what are some early symptoms that people should be looking out for?
Well, thank you. Alzheimer's disease is the most common cause for dementia as we get older. Dementia, I have to digress, is a big tent word referring to a loss of memory and problem-solving ability greater than expected for normal aging. Alzheimer's disease is the most common cause for dementia. It's an example of a neurodegenerative condition where the nerve cells and the circuits in the brain that allow us to form memory and solve problems slowly fail. Alzheimer's disease is defined by a buildup of several misfolded proteins called plaques and tangles. And the plaques contain a protein called beta amyloid, and the tangles contain a misfolded protein called phosphorylated tau protein. The amyloid can build up very slowly over decades before there's symptoms. The brain is pretty resilient. But once the tangles start to occur, we see the early symptoms of Alzheimer's. The tangles start to affect the memory centers of the brain that we call the hippocampus. And one of the earliest signs of Alzheimer's is a difficulty in recording and retaining new information that we are experiencing.
So that's something people should look out for.
Yes, if we're all forgetful, we don't have, very few people have a photographic memory, so it's a little bit hard to know when we should worry about forgetting, because we all forget. But when we forget the things that are really important to us, or really the family notes a big change in our ability to remember. Now, there are many other causes of dementia. The second most common group are related to blood vessel disease, strokes. And then there's a third category that actually can be reversed, and they're related to the balance of hormones, the balance from the way our kidneys and lungs and heart function, and it could be side effects even from medications. So if a family member or person is noticing early signs of memory loss or more difficulty solving problems or remembering, it's really important to see a physician that's has expertise in figuring out what is the cause, so that a more specific treatment can be given. And some causes of dementia are treatable.
So much research being done around this disease, and you are also involved in the Healthier Vessels, Healthier Brain Study research program. Tell me a little bit about this program.
Yeah, I'm a professor at USC, University of Southern California. We have one of 28 nationally funded NIA Alzheimer's disease centers. Our center focuses uniquely on the role of blood vessel and their health and their relationship to Alzheimer's disease. So we are studying what we call the blood-brain barrier, which actually keeps the blood separate from the brain, keeps the brain kind of in a very clean and protected environment. And also, we're interested in the blood-brain barrier, which is necessary to pull amyloid out of the brain and let it be cleared through the blood vessels. We're very interested in keeping blood vessels healthy by reducing the risk factors, high blood pressure and diabetes. I'm particularly interested with my colleagues in how diabetes affects the capillaries of the brain, which are really the smallest blood vessels where red blood cells have to go through in single file to give off the oxygen. The blood gives glucose to the brain and then takes the waste products from the brain out. So we're trying to understand better how diabetes and how it can damage the smallest blood vessels in the brain, the capillaries.
And with Healthier Vessels, Healthier Brain Study, you are looking for participants as well. So how can people sign up or find out more about this program?
Well, thank you. There's a brochure and there's a phone number for our recruiter, coordinator, Nadine Diaz. Her phone number is 213-821-7158.
Great. And you're currently accepting participants?
Yes, carefully and safely.
Okay.
So with the pandemic going on, we had a full stop to our observational studies. We kept our clinical trials going because it was very important that people taking these medications, investing, that they still be able to have access to the study medication.
I know when we think about this disease, it's constantly 65 and older. But there are people that have been diagnosed with Alzheimer's that are younger. What are your thoughts on that? And should people in their 30s and 40s start thinking about this disease and how to prevent it?
There are 3 genes and mutations in those 3 genes that can increase the risk of Alzheimer's markedly. And unfortunately, then, the symptoms can start in the 30s and 40s. Fortunately, these are rare mutations, so it's less than 1% of all Alzheimer's. Persons with Alzheimer's have these autosomal dominant mutations.
Dr. Chui, for someone who wants to be a part of this study, what is the criteria?
We're looking for the healthier vessels, healthier brain for individuals who are over 60 and who have a diagnosis of early diabetes or pre-diabetes, who are not taking insulin and who are willing to be followed annually for about 5 years.
Great. Something else came to mind that I must ask you. So when we talk about symptoms and prevention, there's the common thing of, oh, I forgot where I put my glasses. Or my mother will come and say, I had to go get something in the garage. I forgot. Should we be concerned, or are those just typical aging factors?
Yeah, those are typical. We all experience that. Yeah, so it's like we have the medical student syndrome, and then we can have the TV syndrome. That not to worry. So it's when it's repeated and when it's if we're distractible and now in this day and age we're on our cell phone and we're homeschooling and
then be concerned,
it's okay.
Right?
Yeah.
Okay. Because of the complexities of Alzheimer's, how do you encourage your patients to stay hopeful?
It's really important, I think, to think about us as a village and a community to go through this together. And we're there in our academic institutions like USC, UCLA, our family physicians, we're here for our families. We join as a village with our national partners like the Alzheimer's Association, Alzheimer's Los Angeles. We try to focus on quality of life.
Well, as you said, it takes a village.
Yes.
And we've just got to keep moving forward. So, Dr. Chui, thank you so much for taking the time to come down here and talk to us about this disease. And again, with the Healthier Vessels, Healthier Brain Study, we did provide the information. If you are interested, please do look into that study. And once again, thank you, Dr. Chui. November is Alzheimer's Awareness Month. Thank you all for joining us today. I'm Rasha Goel with LA Currents.